So, for today, I will be discussing coronary artery disease and its risk factors o mga kadahilanan ng sakit ng CAD. So, one of the most common diseases in America is atherosclerosis. 50% of deaths are attributed to myocardial infarction, and atherosclerosis is the principal cause of death in the Western world. Atherosclerosis begins in childhood and advances throughout life. So ito po yung example natin. So atherosclerosis is a progressive disease involving, next slide please, the development of arterial wall lesions. So as they grow, these lesions may narrow or occlude at the arterial lumen. So pwede pong magkaroon ng bara. Complex lesions may also become unstable and rupture, and leading to acute coronary events such as unstable angina, myocardial infarction, o tinatawag nating heart attack and stroke. Next. So, the following are the atherosclerosis risk factors or mga kadahilanan. So, isa na po dito yung cigarette smoking, hypertension, diabetes, obesity, age, male gender, any event of previous coronary artery disease, and yung pagtaas ng cholesterol, especially yung ating LDL or triglycerides. Ang mga susunod ay ang mga risk factors na hindi natin mababago. So kabilang dito is family history, increasing age or ang edad na higit 60 years old, and ang gender, which are males. So, totoo po ba? Yes po. Mas madalas po na apektado ang mga lalaki kaysa mga babae with coronary artery disease. So, one of the major risk factors that cannot be changed o hindi natin mabago, again, is yung increasing age. So, over 83% of people who die of coronary heart disease are 65 years old or older. On the other hand, yung mga sumusunod ay yung mga risk factors na pwede po nating makontrol. So kabilang po dito ay high blood pressure, elevated blood fats or cholesterol, obesity or weight, and diabetes. Nandito din po yung paninigarilyo or smoking, poor eating habits, response to stress, and physical inactivity. So, atherosclerosis also has a risk factor of alcohol drinking. So sinasabi nga nila that women who drink more than 28 drinks a week have an increased risk of CAD. However, there is a favorable effect of drinking red wine on the platelets and a definitive effect on CAD. Next po are some of the factors that are protective or makakatulong. So, kabilang po dito is living in a rural area, increase aerobic exercise, mono and polyunsaturated fats and omega-3 fatty acids in our diet, iron, intake of iron and antioxidants, increase of our dietary fiber, increased job control, and also increase in educational level. Ang pagsakit ng dibdib or what we call angina or chest pain is insufficient blood flow to the heart muscle because of coronary artery disease. So, again, what is coronary artery disease? It is a chronic disorder. So, simula pagkabata hanggang throughout life. So, it typically cycles in and out of clinically defined phases, like the following. So, asymptomatic o walang sintoma, stable angina, progressive angina, acute coronary syndrome, wherein there is unstable angina, non-ST elevation MI, and acute MI or heart attack. So, paano ba natin malalaman yung mga sintoma ng heart attack? So, usually, These are the symptoms to recognize a heart attack. Prolonged discomfort, aching, burning, or squeezing sensation in the chest. The feeling of indigestion or fullness, any chest heaviness or choking sensation. Also, sweating, nausea and vomiting, dizziness, palpitations, loss of consciousness, or severe weakness. So how do we classify chest pain? So typical angina or yung sakit ng coronary or yung pagsakit ng dibdib ng meron ng mga patients na merong coronary artery disease are as follows. It is substernal chest discomfort with characteristic quality and duration that is provoked by exertion or emotional stress and will be relieved by rest or nitroglycerin. So the probability estimate, according to the Diamond and Forrester approach, explains that simple clinical observations of pain type, age, and gender were already powerful predictors for the likelihood of coronary artery disease. So, for example, a 64-year-old man with a typical angina, as described earlier, has a 94% likelihood of having a significant coronary artery disease. However, if a 32-year-old woman with no anginal chest pain, she only has 1% chance of coronary artery disease. Next, by the Duke and Stanford models, the likelihood of disease for women less than 55 years old with atypical angina and has no risk factors is less than 10%. However, if the patient is diabetic, if the patient is a smoker with high cholesterol, the likelihood would jump up to 40%. So how do we diagnose how do we diagnose coronary artery disease? Ang mga sumusunod ay yung mga ginagamit natin na diagnostic test para sa ating mga patients with coronary artery disease. So chest x-ray, ECG, stress test, 2D echo, and coronary angiography. Why do we do coronary angiography? So we do coronary angiography to identify high-risk patients in whom coronary angiography and subsequent revascularization would improve their survival. Such strategy can be effective only if the patient's prognosis on medical therapy is sufficiently poor that it can be improved. So the following are photos of what we can see during a coronary angiography. So dito po yung axis kung saan natin pinapasok yung catheter para umabot tayo sa heart and ma-view po natin yung heart. So ito po yung different views ng ating coronary angiography kung saan makikita natin yung mga major vessels ng ating heart. So this is your left coronary artery, your right coronary artery. When there is significant coronary artery disease found in your angioplasty, in your angiography, we could do your coronary angioplasty and stenting. So here, we can see that the first picture on the left, we can see that there is a cut of the blood supply. So that means that we have a significant coronary artery disease or blockade. So once angioplasty is done or the stent is placed, we would see a reflow or yung pagbalik ng dugo sa part ng ating heart muscles. So atherosclerotic disease is a progressive disease as shown in this slide. Many therapeutic interventions are aimed at specific cardiovascular conditions, and these interventions may be directed at alleviating symptoms or preventing progression to more serious stages, or both. So we can use our ACE inhibitors, for example, in patients with hypertension who are at the top of this progression pathway. And these studies would look only at the effects of blood pressure, however, and it would not address the long-term question for risk reduction. So next, the recommendations on treating the risk factors or causes of our coronary artery disease. So class 1 recommendation would be treatment of our hypertension. Next, ang pagtigil or smoking cessation therapy. Next is management of a patient's diabetes. Also involved is exercise training program. We also have goals for our cholesterol in giving them lipid-lowering therapy for those patients who are suspected CAD patients with LDL cholesterol of more than 130. And we should target an LDL of less than 100 milligrams per deciliter. So another recommendation would be weight reduction in patients who are obese and those who have hypertension, hyperlipidemia, and diabetes mellitus. And lastly, for patients with coronary artery disease or three-vessel disease that are not amenable for angioplasty, we do coronary bypass grafting for the treatment. So the following are pictures of the heart during a coronary bypass or yung tinatawag po natin na cabbage. And that's it for my last slide. Thank you very much.